Hello everybody, my name is Margaret Heckman. I am a registered nurse. I am currently employed at the St. Luke's Miners campus in the operating room. I have been here a long time, and my topic today for my change in this initiative presentation is going to be on flexible scheduling. But it's going to be a little unique. It's not going to be about nursing in general. It's going to be specifically about perioperative nursing. Our OR, like I said, is rather small, and we operate on an 8-hour-a-day schedule. So we work Monday through Friday, 8 hours. However, there are emergency surgeries, and the operating room has to function for 24 hours. So that means a call team would be utilizing the OR should there be an emergency. So even though we work 8 hours, we are responsible for a call schedule, and some days our days can be rather long. The reason I was interested in this topic is I was involved in a situation a couple months ago. I was a circulator on a case, and it had been a very busy time in the operating room. Our case volume was elevated. We were doing a lot of call. I was putting in a lot of hours. And like I said, I was a circulator on a case, and unfortunately, during the case, I handed to my scrub nurse a product that was expired. It was expired only by 2 days. However, we utilized an expired product on the case. This created a big red flag. It really was a mistake. We had, of course, filed an incident report. The patient was notified. No harm was done, but it resulted in peer review and intense analysis. We were called in as a team. We had to review everything that we did wrong in the case. We talked about things that we could manage, ways that products do not expire. We have double checks and balances, and overall it was a very valuable experience because this is to prevent things like this from occurring. However, one thing that was mentioned was the fact that they looked at the times of all the staff, what they were working. And I was labeled as I was working excessive hours. And it was true at that particular time. Like I said, I was on call. We had a lot of call cases. I was there late the past 2 nights in a row. I started my day, and I really felt that I could have been in error because I was tired, I was fatigued, and I made a mistake during the case. So that was really what I honed in on. And I asked myself, what could I have done differently? And as I thought about it and I thought about it, the answer was nothing. There was nothing that I could have done differently. I work 8 hours, this is my job, I need to cover call, and I really didn't have anybody to cover for me. I didn't have anybody to ask, could you cover my call? Because that would leave a deficit somewhere else within the department. So it got me thinking that flexible scheduling is going to be very important. Again, like I said, in flexible scheduling, nursing is a 24/7 operation. When we think about flexible scheduling, we think of nurses doing 12 hours, perhaps doing a weekend program, but it's really not applied to an 8-hour setting. However, I think it could be beneficial. So my objective for this presentation is to present various flexible schedule options in the perioperative setting that allow employees to utilize their full potential at work by achieving a better relationship between their personal and professional lives. Some flexible schedule allows control over the hours worked. This is what I was talking about in my particular situation. If I felt tired, if I felt fatigued, hopefully I would have had some type of control over getting some downtime and being able to rest. Other benefits to flexible work schedules, it does benefit the patients, the staff, and the organization for which they work. By working longer days, it means having more days off. Less hours commuting, less time in daycare for children, if that should be that would be a problem. Promotes better work-life balance. It can be a very good recruiting strategy for hiring help. It's definitely a perk to have a flexible schedule with your job. It lessens staffing shortages, and it is great retention when employees have flexibility. If you have flexibility in your job, you are happy and you are more likely to stay at your job. Okay? So some of the ideas that we talked about presenting in the operating room that would really be applicable would be such a thing as a float pool. And this is where we would cross-train staff to cover areas where when other employees want to be off. I think this is unique to the surgical area because there's really three areas that comprise the surgical area. It's same-day surgery, it's the operating room, and it's PACU. By cross-training the staff in all three departments, they could alleviate a deficit in different departments. We have actually began utilizing this, and it has been a very valuable tool, and it has been very effective. Job sharing, one full-time position is replaced by two part-time positions. I was just thinking, if I was a part-time employee when this particular situation happened, I knew I would be here late the night before. I would call my counterpart and say, hey, it's a long night, can you cover for me tomorrow? We could switch days and I would not have been as tired. Okay, another option are per diem registered nurses. And these are per diem nurses that are trained for the job. They work as needed. That fits some people's lifestyle. They're very happy being per diem nurses. They usually do receive a higher salary, but in most cases they do not receive benefits. Okay, alternative scheduling, and this is what I was talking about, which I think would be very valuable. As I said earlier, we are an 8-hour day operation. We work 5 days a week. Most days turn into 8-10 hours. If we work 10-hour days and work 4 days a week, that would give us an additional day off. If I had that additional day off, my call night would be the night before. If I was here late, I'd have that additional day to recover. Also, options could apply to starting early, leaving later, and possibly working on weekends. That so much does not apply to the operating room because we generally don't have weekend work unless it's emergency work. And another strategy for flexible scheduling is telecommuting, working from home. That's really not applicable to the OR unless you want to do surgery in your dining room. Mm-hmm. So some advantages to flexible scheduling is it provides choices to nurses. This promotes autonomy and it empowers the staff. Okay, they feel that they're in control of their lives, they feel they're in control of their work, and it is definitely a benefit. It provides more involvement in decision making. When we talk about doing flexible scheduling, we would promote that they do their own schedules. They work around their busy lifestyle. Again, all in an attempt to promote work-life balance. Studies have shown that some health conditions such as digestive problems, chronic fatigue, and psychological issues have lessened when people have more control over their jobs and their lives. One study showed a 41% reduction in sick leave when a trial flexible scheduling system was in place. People do not feel the need to call in sick. Again, they feel that they have more control over their lives. Promotes satisfaction, therefore nurses are less likely to experience burnout, and absenteeism and turnover is reduced. Okay, a shorter week, if we worked a 4-day work, it means having more days off, more time to yourself, more time to spend with your family. We've noticed in the past when people can make their schedule, they clump their days together that they want to work, and it gives them some prolonged periods of time off. Often people will seek a second job for additional income. They find that to be very helpful. Okay, other advantages are nurses are more likely to embrace the organization, challenges and change, and nurses are more willing to work extra shifts. Okay. Unfortunately, there might be some disadvantages with this, and most of it does come with fatigue. So it's about strategically planning your days off around a flexible schedule. Longer shifts can lead to more fatigue, which can lead to more errors. One study reported that there was an increase in the amount of needle sticks on nurses who work 12 plus hours per shift. A lot of times you have you're scheduled for a 10-12 hour shift. You're there overtime, and that 10-12 hour shift turns into a much longer day, like 14-16 hour day. Okay, you might leave your job being tired. Drowsy driving is a risk that leads to increased motor vehicle accidents, and there have been situations where there's increased risk of depression, anxiety, obesity, cardiovascular disease, and cancer in people who have worked longer shifts, and this is probably related to prolonged periods of stress. Okay, so I have some questions I would like to ask. What two out of the strategies that I talked about, what two strategies do you feel would be best in the perioperative setting, and why? And the other question is, can you identify any barriers that might prevent flexible scheduling from working? I can tell you we are in a trial period of flexible scheduling, and it has been working. It is very valuable, and I think it's a perfect answer to work-life balance. Thank you.